Our next topic is healthcare-associated infections. Oftentimes you will hear the term healthcare-associated infection or healthcare-acquired infection. Both of those typically just get abbreviated to HAIs, but you might also sometimes hear the terminology nosocomial infections. All of those are the same thing, which are basically infectious diseases that are acquired when a patient visits a medical facility. So it seems kind of counterproductive that someone would go to a hospital because they have cancer or diabetes or are pregnant or whatever it be, and then while they're under the care of the medical facility, they acquire an additional infection. But it does happen quite often. So there are different types of HAIs that result because of this. One of the most common being urinary tract infections as a result of catheter usage. The urinary tract is meant to be sterile, so if any point a bacterium gets into the urinary tract, it potentially could cause a UTI. So because you're taking a catheter, which is external to the body, and then you're putting it into the body, it is common for it to inoculate bacteria into that region, which can cause an infection. Surgical wounds can get infected if they're not being kept clean and covered. Bloodstream infections happen as things like IVs are put into the blood supply that could inoculate infectious pathogens into the cardiovascular system. And then if we think about respiratory equipment, if the respiratory equipment is not properly sterilized before use, you could inoculate bacteria into someone's lungs and potentially lead to a case of pneumonia. So collectively, HAIs or healthcare-associated infections are infections that occur at some type of medical facility. There's not a specific type of bacterium that you need to know that causes HAIs. Some of the most common bacteria in a hospital type setting that cause healthcare-associated infections are things like Staphylococcus, Escherichia coli, various types of enterococci that cause gastrointestinal infections, and even Candida, which is a type of yeast. All of these have been isolated from medical facilities and have caused things like surgical wound infections, urinary tract infections, and even respiratory infections related to pneumonia. We went over the various causes of how these things could happen, but we kind of have to take into consideration of why these things are so common. I mean, you have someone coming into a medical facility because they're ill, so they're already immunocompromised from whatever ailment they have that's brought them to the medical facility. So you have someone that's immunocompromised coming into a medical facility where many other people potentially have infectious diseases, and those infectious diseases are highly contagious and can spread from person to person. So we think if someone's immunocompromised, they're putting themselves into a place that's essentially a breeding grounds for infectious microbes. They could pick up infections from other healthcare workers, from other patients, from friends and family that are visiting other patients, and again, from devices that are used in the hospital, indwelling devices like things like catheters and IVs, but then even something as simple as someone's contaminated gloves, or maybe a thermometer that hasn't been sterilized. Even things simple like that could potentially transmit healthcare-associated infections to other individuals. So there definitely are some key things that can be done to prevent HAIs from happening. Frequent hand washing, especially if you're on the healthcare provider end, and then obviously proper glove use and proper use of face masks. Removing those indwelling devices as soon as possible. The longer those devices are within the body, the more likely we are to inoculate pathogens into those regions like the blood or the urinary tract. Proper antimicrobial use, so in instances where antibiotics are needed, we have to be cautious about how we prescribe those antibiotics and make sure that they are used properly, that they aren't used for unnecessary viral infections, and we're not overusing things like broad-spectrum antibiotics, which can be prone to creating resistant strains of bacteria. And then obviously routine disinfection of all surfaces, proper sterilization of equipment such as ventilation equipment, so that we don't potentially cause something like pneumonia. So the next thing we'll talk about is epidemiology. Epidemiology is its own field that microbiology does feed into. So kind of a textbook definition of epidemiology is the study of factors and mechanisms involved in the frequency and spread of health-related problems and diseases within humans, plants, and other animals. So really, epidemiologists, people that study epidemiology, are disease trackers. So they are going to track how diseases are progressing within a certain population over a certain period of time. So definitely there are epidemiologists that focus on infectious diseases. We saw this going through the COVID-19 pandemic. But there are epidemiologists that also study how cancer is progressing within a certain population, diabetes, drug use, alcoholism, all different types of things. Obviously, for the context of this course, we're more focused on epidemiology as far as tracking infectious diseases, but it really could be anything. So they're going to want to study, what areas the disease prone to. Is there a certain gender that's afflicted more, a certain race? Is there a certain age that you're more predisposed to getting the infection? What's happening with those immunocompromised patients? How is the disease being transmitted from person to person? Is it spread through direct contact, indirect contact? Is it highly contagious through respiratory droplets? How many new cases are we seeing? What's the death rate? Those are types of things that epidemiologists would be looking at. So epidemiologists do typically, being an epidemiologist does require pretty good math skills. There's a lot of statistics rates that we have to calculate for epidemiology. You are not going to be doing any calculations for this specifically, but I do want you to be able to define the various different rates that epidemiologists would be looking at. So two terms that epidemiologists typically look into are the incidence rate and the prevalence rate. So the incidence rate is the number of new cases that is occurring within a specific population over a specific period of time. So for example, and this number is entirely made up, if we say that since January of 2023, there have been 100,000 new cases of COVID-19. Since we are looking at the number of new cases, that is an incidence rate. So anytime we're referring to new cases over a period of time, we're talking about the incidence rate. The prevalence rate is the total number of cases. Since the ongoing of the outbreak, the total number of cases, so both old and new. So for example, and this is a factual number, there has been a total of 104,348,746 COVID-19 cases reported as of April 12, 2023. So that would be the total number of cases since the onset of the pandemic in the United States, which was something like March of 2020. So incidence rate is the number of new cases that are being contracted, whereas the prevalence rate is the number of total cases. And typically when epidemiologists are watching how a disease is progressing within a certain population, they're really digging into that incidence rate, because what they want to see is eventually that the incidence rate slowly kind of drops off. Because obviously if the incidence rate keeps getting higher and higher and higher, that tells us that we're getting more and more new cases of that infectious disease every, however long we're looking at the time period, every week or whatever it be. So that kind of tells us that the disease is still progressing within the population. However, once that incidence rate starts to drop off and week by week we continue to see a lower and lower and lower number of new cases, that's telling us the disease is no longer progressing as rapidly within the population, whether that be because individuals have gained immunity or they have acquired a vaccination. And we kind of saw this trending during the pandemic. There was definitely a long period where we saw that prevalence rate just keep going, the incidence rate, the number of new cases keep going up and up and up and up. But then eventually, as people acquired immunity and we have vaccines, that prevalence or that incidence rate did decrease. Other terms that we use are morbidity and mortality. So morbidity is very similar to prevalence. It's still the total number of people that have been succumbed to the infectious disease. So it's the total number of people that have acquired the infectious disease, the total number of people that have become infected with COVID-19 or tuberculosis or influenza or whatever infectious disease we're talking about. So morbidity and prevalence, those terms can kind of be used interchangeably. They essentially both mean the same thing, the total number of people that have acquired the disease. Mortality is different. Mortality is essentially the death rate. It is the percentage of people that have died from the disease. Fortunately, due to modern day medicine, while the morbidity rates are still relatively high, while we still have quite a few people that become infected with pathogens, the mortality rate is much lower than what it used to be. So because of things like vaccinations and just modern day healthcare, mortality rates are much, much lower, even if people still do get the infectious diseases. So the next thing we'll talk about is how diseases spread within a specific location, and these are terms that you likely have heard before: endemic, epidemic, and pandemic. An endemic disease is disease that is constant with relatively low spread in a specific geographic location. So every country, or even or certain areas within a country, are going to have diseases that are endemic to that area. So for example, in Africa, malaria is endemic to that area. We know it happens in that area. It's pretty much constant, and we can predict that there's going to be X amount of cases every year. Even to this point, COVID-19 has become endemic in the United States. It's been constant year after year, so it's kind of generally just expected. So as long as the disease is constant in that area and expected, so we generally know about how many cases we're going to have year from year, the disease is endemic. Now, if one year we all of a sudden see a huge peak in the incidence rate, so there's a huge increase in the number of new cases, then it becomes an epidemic. So if we have 1,000 cases of Lyme disease in 2021, 2022, and then in 2023 we have 1 million cases of Lyme disease in the United States, then that year, 2023, Lyme disease would be epidemic. So an epidemic is when you see a sudden outbreak or an increase in the number of new cases with a specific infectious disease. And then if that epidemic spreads outside of that specific region, so in this case outside of that country to multiple other countries, then it would become a pandemic. So when an epidemic starts to spread worldwide to various other countries, then it makes the shift from epidemic to pandemic. So epidemics have an increased rate, so a higher incidence rate within a certain country. And then once the infection spreads to other countries, then it becomes a pandemic, which is unfortunately very easy to do nowadays with modern day travel. So if we have an epidemic, for example, in China where COVID-19 started, with modern day travel, it can become a pandemic relatively fast as individuals travel to other countries with highly infectious diseases. It's very easy to transmit them to other individuals.